In today's video, we are doing arm lipo, arm vaser liposuction, and I am marking the arm before we start the procedure. We want to take out the fat and do some skin tightening, and this is how I mark for the procedure. We want to make sure we take out the fat at the right areas of the arm, and so we mark where most of the fat needs to be taken and where you need skin tightening. Also, you want to give her some arm definition, and we are going to define the deltoid so it just doesn't look like a slim arm, but it also has some fine definition and has a sculpted look to it. Doing an arm lipo, and this is the marking we've done, and I am going to make a tiny incision to numb that incision point. I'm going to give it a tiny little shot, and that's it. How was that? Okay, not too bad. Okay, and we're going to do another one. Little shot right there. We make a very tiny incision to do this procedure, and this incision heals very quickly. Thanks. So this is our first step, and we are numbing the area where we're going to do lipo. I'm almost done with this. I'm infusing a fluid called tumescent fluid that has lidocaine, which is going to numb the area here. As you can see, patient is awake and very comfortable during the entire procedure. So we are numbing the other arm. We are repeating the same thing, infusing the numbing fluid. It might be stinging a little bit, but it very quickly numbs you. This is our second step, and that is melting the fat, and I'm using the Vaser probe to melt the fat. So we are going to Vaser for about 10 to 15 minutes to emulsify or melt the fat we want, and this also tightens skin. And I do right under the skin. We are tightening skin, tightening the collagen, and we go deeper to melt the fat. And this part is very comfortable. She's fully numb, so hopefully she shouldn't feel any pain at all. Arm lipo is a very quick and a gentle procedure, and we get some great permanent results. So now we have all the fat melted, and we're going to suction the fat out. And this is also a very gentle procedure, totally painless. We are now done with suctioning of the fat. The arm already looks very slim, skin's looking great, and we have suctioned about a pound of fat from her right arm, which would be equivalent to about 500 cc's of fat. Now we're going to do the same on the other side.